Dr. Quimby is the newest addition to the NSU Oral and Maxillofacial Surgery family. She received her dental education at the University of Illinois, did a 6-year OMFS residency at the University of Florida, Jacksonville, and continued on to do a fellowship in head and neck oncology and microvascular reconstruction. After years of education, Dr. Quimby decided to join us here at NOVA as an assistant professor. AAWD is extremely privileged and honored to have Dr. Quimby join us as our first guest ever on our Doc Talk series. Everyone, please welcome Dr. Quimby. Yay! Welcome, Dr. Quimby. All right, so we've got a bunch of questions for you. Some students submitted some questions too, so everyone's really excited to meet you. So just to start off, just tell us about your background, where you grew up, and can you elaborate a little bit more on your educational path, beginning with undergrad and onwards?
Okay, we're gonna need definitely more than 40 minutes for that. So I was actually born and raised in Ukraine. I moved to the United States when I was 18. By then, I had already completed 2 years of med school back home because the way the educational system is set up over there, we basically go through school, high school, and then you go into professional school that includes your equivalent of undergrad that usually is wrapped up in about like a year and a half or so. In combination with all the humanities classes and things that you would consider like undergraduate level classes, we were taking things that would be like specific to getting you ready to be a doctor. So by the time I got to the US, I had taken, all your human anatomy, normal physiology, and basically all the normal things that you take within the first year of med school. I had already completed that. Then when I came here, I moved to Chicago. That's where my family was. And I had to basically start from scratch because the things that I did in Ukraine didn't really sort of qualify or transfer to anything here. I think I got like maybe 2 or 3 classes transferred and everything else I had to sort of redo. So I went to like community college first. I think I was in a community college for like a year and a half or 2 or something like that. And then I applied to University of Illinois, Chicago, where I did my undergrad in biology. So I got a BS in BS. And then after that, I went to dental school at the University of Illinois, Chicago too. And then, the residency and fellowship at University of Florida in Jacksonville. And probably somewhere at the end of my dental school first year, I was kind of pretty decided, I guess, that I was going to do surgery. And it stemmed from me seeing like an intro, actually Dr. Malora, who is currently also a program at UIC's OMFS. He's a program director. We had one of like specialty nights and such. So he gave us like a little intro to what, maxillofacial surgery does. And he just had these crazy pictures of people with like their faces blown out and, necks opened and things like that. And I was just sort of like, wait a minute, like we can do that? And I'm like, these are the types of things that I do in the anatomy lab. I was like, and I can actually do that for work, for a living? I was like, no way. So then I did my externship at University of Illinois, Chicago first. And then from that point on, I was just like, okay, there's no way I will do anything else. And that pretty much kind of set me on the path to getting here.
Nice. I was actually going to ask you that next, why oral surgery? But I guess you answered that it was just in your 4th year, you kind of saw something that you probably didn't realize you could do, and then no looking back.
I was just I loved anatomy, so I really loved, I actually was participating in different like cadaver studies and stuff where we had to go in and dissect things like during summer semester and whatnot. And the more I was doing anatomy, the more I was realizing that I really like, digging around in people's necks. Yeah. And I was just like, well, from this point on, there's like only one path for me, I guess.
That's awesome.
I think it's funny you say that because in like my experience, I was a surgical assistant for 2 years for an oral surgeon, and my first shadowing experience ever was with a periodontist, and I loved it. And then my oral surgeon, the one that I worked for, was in private practice, and a lot of the things overlapped. So I never saw the aspect of neck dissections. And then I was like, well, you know, like if my boss could do it, this is something I love and I know, and I'll do it. And then I saw our beautiful Dr. Ospina's lectures on neck dissections, and I was like, ooh, maybe I can't. Like it will almost like drain.
It'll drive you that way or drive you in the other direction.
Yeah.
Let's keep it to the oral cavity. Maybe. Let's hone in surgery there. But it is incredible, some of the things that I mean we've been taught. It's wild.
So on that note, I probably wouldn't recommend watching any of my lectures that I'll be giving because they'll be graphic.
Yeah, you need that disclaimer in the beginning, like viewer discretion is advised.
Mm-hmm.
Explicit content.
Exactly. Okay, so my next question is that some people who may not be as familiar with oral surgery may not know that there's a 6-year route and a 4-year route. You know, there's this huge debate about what's preferred, and you did the 6-year route, so you got your MD. What's your whole perspective on the 6-year versus 4-year route, and why did you choose to do the 6-year route?
I think it very much depends on sort of what do you see yourself doing in the future. I think it's awesome to, you know, pursue as much education as you want to and as you can. And if you're just like a curious type of person and you don't know quite yet what you want to do, but you may be considering doing a fellowship, maybe considering pursuing some other things, a 6-year route is probably for you because first of all, it'll give you more time to explore options that you may have. And second of all, it basically will prepare you for anything. So even if you decide to not, you know, pursue anything else in addition, and you just, you know, like I've had enough and I just want to go out there and live an adult life and have a job, you know, and stop being this eternal student, then, you know, then you can do that after finishing 6 years. Nobody will tell you no. If you then 6 years was quite not enough for you and you're like, you know what, I really love just, you know, being a student forever, and really the, you know, the outside world scares the bejesus out of me, I really don't want to like start being on my own, then you can pursue opportunities of like fellowships and such. So I think it just kind of gives you liberty to decide what if, you know, I'm gonna want to do whatever. Not to say that if you go to a 4-year program, you're not going to be able to attend fellowships and whatnot. Beliefs attached to like 4-year programs versus 6-year programs. And I really think people don't quite understand how that works on like a technical, logistical level. People generally, if they want to do a fellowship, it is difficult for, on the basic level, it is very difficult for a hospital to give you the privileges and such. You have to jump through like additional hoops, and you may be limited in what you're going to be able to do. And that's why a lot of fellowship directors, they prefer to hire 6-year guys, because that MD makes things with regards to obtaining privileges and just like moving around the hospital and whatnot a lot easier. I think if you're someone who's decided that, you know, I know I want to do private office-based LMFS where you can actually do a lot of cool stuff, and you can do a lot of benign path, and you can do, you know, you can do a whole lot of stuff, but you know that academia is not for you. You know that, you know, you're not ever going to consider doing any fellowships or anything like that. And personally, I don't really know if it's worth it for someone to kind of, you know, take 2 additional years where you don't build your, you know, your private career up, but you're basically giving it away to an institution that won't give it back, you know, because like when you're in a residency, you really don't belong to yourself. So I think that's kind of how people should approach thinking about those things, not so much about like, oh, you know, whatever, dual degree, single degree, who cares? It's like, what is it that you want to do? And what is the best route for you? And what are going to be the benefits of you choosing one versus the other? There's any inkling on your side where you're like, I might want to do something else, then it's probably a safer bet for you to open up more doors for yourself to take those 2 extra years of school and get that other degree. So then you then have options and have ability to sort of play the game on your, you know, by your rules and kind of choose things for yourself.
That makes sense. That's actually a good perspective to have, because I keep hearing like 4-year versus 6-year, and there's not always that much detail. So I really appreciate that answer is very honest and true.
Because in reality, there really isn't that much difference. You know, when you come out, there's some 4-year programs like this one over here that prepares you to do basically anything. I mean, you do neck dissections, you come out of here prepared to do whatever it is that you want to do.
Makes sense. The next question I have for you is, there are obviously a lot of different oral surgery programs across the U.S. Why did you choose the University of Florida for your residency, and why did it stand out to you?
I'm glad they chose me, and I chose them. We were a 1-to-1 match. You all know about the match process. So they were my choice, which, when I got that email in the morning, I was just like, at that point, I knew my life was complete. I'm like, I'm all set. This is it. Like, stars aligned, but so as you kind of probably already understand sort of the type of person that I am, I was interested in big surgery. And whatever the big surgery was, like, I wanted to be in it. So I didn't really care whether it would be trauma or cancer or whatever it is. It's just like, I wanted to be able to like do it all. And I really didn't so I did not extern at Jacksonville. I externed at my institution, University of Illinois, Chicago. I externed at Alabama, UAB. I externed at Parkland, and I externed at Mass General. And I sort of picked those places because they were not quite similar. And I wanted to see which one is going to be the one that I will like vibe with the most, something that will resonate with me the most. So I did not extern at Jacksonville, but then as I was going along, and that's like the kind of thing, the limiting factor when you're a young applicant and you're looking for places, it's hard to get information on places. And then you just kind of like, the more you start doing externships, the more you start talking to people, the more you get to know the people, then you actually start figuring out like what are the cool places and the good places and whatnot. So like I did not have time to do externships at Jax, but I've learned about it, how awesome it is because of like all the stuff that they were doing towards the end of like the application cycle. So I definitely applied there. And actually Dr. Maloro was the one who went through the list of the programs with me. And he was just like, this program is great. This program is okay. This program is probably what you're looking for. And he just basically really gave me like really good, effective advice and really good pointers on what I should be paying attention to. And I mean, he had nothing bad to say about Jacksonville besides the fact that it may be humid there. And I was like, well, I'm good with that. So, so it was the scope of the program. It was basically everybody only had great things to say about it. And then I've definitely had like, just so much admiration and fascination with Dr. Rui Fernandez, who, I was fortunate enough to work with for 7 years, because he is an outstanding surgeon. He's an even a more outstanding person. I don't know if it's possible to be a more outstanding person than he's a surgeon because he's just, gifted in that field. So it was basically just the fact that they do everything, that Dr. Fernandez was there, and like I already known of him, heard of him, I read his papers, and I was just like, he was like my, I don't know, Justin Bieber or something of the surgery. It was like I admired him so much. So so that was all fun and games, and then actually went and interviewed there, and when we had individual interviews with, I think at the time they had like 6 attendings there. That you had individual interviews with like 20-minute ones, so you had some time to talk. And I hit it off with every single one of them. It's like we were on the same wavelength. Like everything we would be talking about, I was just like, oh my god, that's what I think, or like that's how I think. And I would just be like this is just meant to be. Like we're just, I'm like, I can't even imagine being anywhere else. Like this is where it's at. Like this is my spot. And then they had their op log just kind of like laying around in the conference room on the table. So you can just look through like the cases that they were doing. And the moment I saw that they were retrieving a lollipop stick thingy that the lollipop is on from like a child bronchus, I was just like, yep, I definitely want to be here. Like that's the spot.
That's awesome.
Because like in addition to all the other normal things that they would be doing, like they'd be doing some crazy things. And God knows I retrieved a lot of weird things from people's throats, tracheas and other places in the last 7 years. So definitely it was definitely everything I dreamt of and more, and then some. So
That's awesome. That makes it for like, I bet like a good residency too, to like feel that way about it, even going into it. That's awesome. I hope I feel that way about whatever program I'm applying to. So I'm gonna pass it on to Ria. She's gonna ask the next few questions to you.
All right. Okay. So I'm gonna start off with what motivated you to do a fellowship in microvascular surgery?
The bigger, the better. I just really wanted to do big surgery, and it doesn't really get much bigger than microvascular surgery. Jokes aside, though, I wanted to be able to be that one provider for my patient who doesn't have to send them anywhere else. So I wanted to be that endpoint where I'm just like, if you come to me, I can take care of you, period. You don't need to go see anybody else. And microvascular reconstruction allows you to do that because there's not a defect that you cannot address. So whether it's pathology, whether it's benign, malignant path, whatever it is, whether it's trauma, gunshot wounds, you name it, there's always an answer. Like I have an answer every single time, which just allows you to, give your patient the best possible care, because you don't have to limit yourself because, I don't have the skills to do this. So I'm going to offer you this option because that's what I can do. And I would rather not refer you somewhere else because I want to take care of you because you're my patient,
Makes sense. Yeah.
Mm-hmm.
And then what brought you to Nova after you were done with your fellowship?
So I was not sure where I will end up, probably to like the very last moment where it really started. When at the beginning of my fellowship, everybody started asking me, so where are you going next? And I didn't have a spot that I was telling them yet. I started to get really nervous because I was like, wait, am I supposed to know that already? Like I'm just trying to wrap my head around being a fellow and you guys are already asking me about where I'm going next. Like I just started my fellowship, leave me alone. But Dr. Coltman actually reached out because he, Ashley Y, who graduated from Nova Dental School, she's currently a 5th level resident, a 5th year resident at Jax. They somehow met somewhere at the conference or something, and apparently Dr. Coltman was saying that he's looking for someone to hire for the department, and they just basically offered me up. They were like, you need to hire her. And then we just talked to Dr. Coltman, and he invited me to come over for an interview. And I really liked the vibe of the residents. So I'm very I don't know if you've noticed how many times I use the word vibe, but I like environment where I like being in. So I really value working with people who are good people and don't add stress to already a very stressful job. So I just really like the environment. I like the fact that it's in Florida. How can you not like Fort Lauderdale? But besides all these little things, the fact that the program covers 2 level 1 trauma centers. It has Dr. McClure, who is a head and neck trained surgeon, which is a giant selling point for me because I'm a fresh, surgeon coming out of training. I'm sure there's going to be a situation when I'm going to need help, and having somebody who can give you a hand when you need it most is basically essential, because sometimes it can get really, really lonely when you're in the OR by yourself and you really don't know sort of which way to go. And it's nice to have someone that you can just reach out to, and they are trained in this field. And, it happens so that he prefers to do ablative surgery, meaning he likes to do the resections and such. And it's like a mutually beneficial relationship, because then I can, do reconstructions for his cases, but then also he can help me with whatever things I need help with. So all in all, it was like an overall, and to top it all off, me and my boyfriend, we were planning on ending up here eventually. So our overall goal life plan was to end up in South Florida. We weren't sure when it's going to happen, whatever the case is. So when this came up, I was just like, okay, well, it looks like stars aligned. So we're just going to go ahead and just say yes, and besides Dr. Coltman. And so one of the other, I think, really valid things to consider when you guys are looking for, your next opportunity and whatnot is, do you have people who are there to support you, because Dr. Kaltman was very vocal and very clear about the fact that he wants me to succeed, right? Like, he is like, I want you to be able to, reach your fullest potential. I want you to be able to do whatever it is that you want to do, to like, practice what you want to practice. There was no kind of like, I mean, this sounded like a dream job. And I was just like, is this really happening? Like, is this really going to be my boss? He's amazing, and he's really kind, and he's really nice. And he's telling me that I can, just kind of flex myself to whatever degree I want to flex. And it's just like, I'm like, okay, great. I mean, I don't really, I can't ask for more.
Mm-hmm. That's great. Okay, so next question is, what is something you like to do outside of work? Like, how do you find the balance? Since it's such a stressful job.
We're talking about pre-COVID or post-COVID? There's a difference.
There is.
So, in the pre-COVID world, yoga was definitely one of those things that I was like leaning on heavily, because it really does like just clear your mind. So I really, really, really liked going to yoga. I actually was supposed to go to Thailand and spend 7 days at like this retreat, or not a retreat. It's like a yoga. I guess it's a retreat, but it's like you go there, you give them your phone, you're not allowed to talk. It's like completely vegan. You wake up every morning at 4, and then you do like the exercises, and then you meditate and stuff. So I was so looking forward to that, because I'm like, trust me, like 7 years of stress, I really needed to cleanse my body and soul from everything. But COVID had other plans. It's okay. We'll still go to Thailand. So I had to cancel that entire trip. But I really like yoga. I think is a great, great, great stress reliever for me. I have friends that are outside of work. So I have 2 friends of mine who live in Jacksonville, who we would have like Wednesday girls' night. So like, because Wednesday we'd have our clinic days, and then we'd usually be done earlier. So we would always go hang out to this like one bar, and we would like have our spots at the bar, and like, everybody knew us, and it was like a thing that we did at least once a month or something like that. There's been times when I had to drop everything, run out, and go back to the hospital, but it happens. What else? Travel. Jacksonville is fun, but if you're there for 7 years, you kind of run out of things to do over there. So anytime when we, like me and Kevin, if we had like a weekend off together or anything like that, we would always just kind of go to, my family lives in Chicago, his family lives in New York, and some in New York and some here in West Palm. So we just kind of go out and just travel as much as we can. That's it. Now, I don't really have anything. It's like, I'm just, here in my apartment. I moved in. I was unpacking for a long time. So
how long have you been in South Florida now? Well, when did you start at South Florida?
So technically my first work day was July 1st. And then I moved into my apartment June 15th. So I've been here for like 2 months now.
Okay. There's lots of things to do here.
I know. But I feel like I'm the only person who's left like quarantining or taking it seriously or something. Cause like, I feel like everybody's going everywhere, and I'm just like, no, I'm sorry. Like, I can't do this. Like, I can't do this to my patients. Like, I don't care about me, but I'm just not trying to, sprinkle the COVID on everybody I see in the clinic. So I'm like, I feel like I have a responsibility to my patients that,
No, you've been seeing social media kind of like, it gives me the heebie-jeebies, because I'm like, oh my gosh, people are on planes right now. I can't believe it. Like, what are these people doing? I live with an 87-year-old grandmother, so lockdown is real.
Yeah. And I mean, I'll go to the things that I need to go to. Like, if I need to go like grocery shop, or I need to go to a store to buy something, I will do that. But I'm not going to try to just, go to places for the sake of going to places. It's like, I'll explore Fort Lauderdale when it's safe. I know there's lots of places to go to here, and I'm very much excited and looking forward to finding out about them. Actually, before I moved down, I found all of the yoga places here and some dance studios. There's like dance studios here and stuff. I was going to sign up for all of these things, and, we'll sign up when they open, or when it's safer, because I think they're open now, actually. But.
Absolutely. Before we go into Kristen's questions, was there anything that drove you into academia, or was that just something you just wanted to explore? Dr. Quimby, you're muted.
I think the type of surgery that I want to do and be able to do is basically impossible to do in private practice. I don't think it's even an option. But besides that, being able, I do enjoy like talking about these things. So I love, like, sometimes I just, like, when I operate, I will just talk through the whole thing. And, you know, and then I hear from residents, they're like, oh, it was so good that you know, like, explained it. And I was like, I wasn't really explaining. I was just talking myself through it, but okay. But it's fun to have someone to do the back and forth, and then they'll ask you questions that will make you think and stuff. So I just like the fact that there's someone that, like, always kind of challenges you a little bit and nudges you, and it kind of engages your thinking process. And academic setting is fun. Like, I like the fact that there's always, you know, new opportunities that you can do. There's always somebody who wants to do research. There's always somebody, I just think it's a lot funner. And I think I like private practice setting where I have a set schedule and I don't have any kind of excitement going on, or not too much excitement, is probably not like a really good fit for me. I like it when there's, you know, unknown things happening, when there's like unknown traumas and unknown, it's just, I kind of enjoy that, you know, you have to think on the spot type of approach.
And is private practice ever like a thought in the back of your mind, or a hospital setting is more your thing?
I think personally, I will always be hospital based, just by virtue, again, of like the type of surgery that I will do, and hopefully starting next week. But I do, so I have this goal. I have like a 5-year plan and such, but I do want to provide sort of room for people to do office-based OMFS in some shape or form, where I want to like create, it's a topic for a whole different interview, but I do see myself playing a role in a private practice, but not so much as a practitioner myself, but just kind of setting up an environment where we can create like a team of OMFS docs where they can like do cool stuff in the office.
That's great.
Mm-hmm.
Okay, I'm going to take it away from you now. All right, Dr. Quimby, my first question for you is, how were you able to cope with being on call at nights during your residency?
The way stuff was set up in JAX, you were 24-hour call during your intern year, and it was in-house. And when you're busy and you're running on adrenaline, you don't really think about coping. You just think about getting the tasks accomplished. So it's not something that you like notice, or you do notice being tired, but it happens at like 6 a.m. and your shift is basically done. And it seems wild and it seems crazy, but when your body gets into this mode, it just functions different. You don't really kind of worry about that, because if you have a guy who's bleeding here and a guy with, broken face over there, it's just like sleeping is like really not something that you kind of even crosses your mind. Sometimes you would have a task of like 5-6, or a list of 5-6 tasks that all need to happen immediately, and they're all urgent, and you're just like which elevator is closer so I can run take care of this, and then like go do that and go do that. So sleeping is really not something that you will notice when you're actually on call. Then after that, you only have to do that for a year, right? If you are a categorical intern. Then after that, we were taking what's called a backup call. So you're a senior resident, you have an intern in-house, and then if they have, any issues or they need your assistance with handling whatever tasks they're handling, they'll call you. And most of the time you're able to solve issues by phone, because now fortunately we have access to, we can remotely log in and look at images and do other things. When they call you to go in the middle of the night, when you're on call as a senior and you need to go to the operating room, it's always something serious. So then all the sleep again just leaves you, because you're worried about a patient having a problem with something, so you just kind of rush over to the hospital, and nobody wants to sleep at that point.
Okay, thank you so much for your answer.
Cool.
My next one for you is, as you know, like right now a lot of students are in the process of submitting their applications for their respective residencies. Mm-hmm. What do you wish that you knew when you were applying, going through the same process that you know now?
It's a really good question. I asked that question a lot of times, actually, of people on different occasions. What I wish I would have known. I think as a dental student applying for residency, there was a lot of times that I was stressing about things that are so absolutely worthless to be stressing about. So if I could tell myself something, now to 7 years back, I would just tell myself to relax, and because and you can't really blame an applicant for being that way because you don't know any better, because you haven't really seen or experienced the other side. So you don't really have an idea what actually matters. So you tend to focus on things that you think are a big deal, but in reality, they're like really not. So I think I wish I had known that I didn't have to stress so much. That's probably the bottom line, because in reality, there's only very few things that matter. And I think we tend to take people in like the position of like, the attendings, the directors of programs and the chairman and everything as like these like creatures who are in control of like our entire like well-being in our life. And they're not, they're humans, they're humans. And if you come to them and they will, and I was actually really amazed and impressed with how understanding people are. Because from where they are, they have seen things and a lot of things, and they have a very good idea what matters and what doesn't. So they will not be stressing you out for no reason. So it's just, it's a perspective thing, but I think you can gain it until you actually go through these things. So just, if you feel overwhelmed at any point in time during the application cycle, just remind yourself that overall probably won't really matter when you look back 4 or 6 years from now.
Was there anything, I guess once you get into a residency and a program, you get to know the directors on a personal level. Was there anything that they said to you that said, no, that didn't matter, but this mattered? Anything in particular?
Not really. It's more of a feeling rather than like fact. I don't really know if I'm explaining myself right. It's just that, we tend to like scores and letters of recommendation and like blah blah blah, all these like minutia, which are important at this point in time for you guys because that's what will get you in the door. But then also it really is not worth stressing about it as much, because what matters the most is that you demonstrate your authentic self when you given the opportunity during the interview. Don't let the sort of like herd mentality of stress about, specifics of do this, don't do this, say this, don't say that, answer this question like this. Don't let that sway you from who you truly are, because I think you're going to be the happiest when you go through your application cycle as your most authentic and honest, true self, because that's what allows you to find that spot where you belong. Because I've had interviews where I was like, literally at the end of the interview, people would be like, oh my God, you said what? Why would you say that? They'll nix you. And I'm like, that's cool. Like I already nixed them. I don't even want to be in this program because I don't. Like, we're not a good match. Then it's fine. So just
vibe, all about the vibes.
I was about to say the vibe.
It really is.
I'm definitely going to take that advice. And I know you kind of touched on that in reference to the question I'm about to ask you. But if you do want to add on any more, if you have any more tips, in your opinion, what makes a strong applicant for the oral and maxillofacial residency?
So there's few like discrete factual things that you need to have. And then everything else is basically your attitude. So the few discrete things that you need to have that will get you the interview are the grades, which you guys don't even get anymore, are your scores, which, and that's like the thing that you stress about it while you preparing for it. But once you kind of took it and just, don't let that stress you. It is what it is. Not everyone who gets accepted into, I know personally people with basically perfect scores who did not get into residencies. So don't ever be fooled by thinking that if you like got the great score, like it's a done deal. It's not, it really isn't. I think the most important thing is, again, being honest with yourself. Why are you doing this? Have you like had a conversation with yourself? Did you think about it? What is it that why are you doing this? And if you just remember that for yourself and you carry that through your cycle and you communicate that authentically to the people you're talking to during the interview cycle and as you meet everybody. And right now, I think mostly it's going to be like Zoom interviews and stuff like that. So, which makes it even more challenging. So I don't even know how to give you guys advice on this. But I think being honest and being, true with yourself and with others is the thing that will get you in every single time. But that, again, that means that you know why you're doing this, and you have to get, I think the latest on scores, it's like 68 and above or something like that. Does that sound right?
Yeah, everyone always says to like aim around 70-ish. That's competitive, but every school has their like cutoffs, I guess. So there's like unspoken cutoffs and spoken cutoffs. But you just want to aim for the best.
Mm-hmm. Yeah. So, but I think once you got the interview invite, do not compare yourself to anybody else. Don't focus on what others have done or didn't. Focus on just, again, representing yourself from, the most honest standpoint and just really communicating what is it that you want to do and why is it that you want to do this. It's not an easy residency to do. It's taxing both like physically, emotionally, mentally. I mean, any residency in medical field is stressful. That just comes with the territory because you're dealing with other people's lives, with other people's well-beings and such. And you're entering into the world where everybody has a strong personality. So you need to remember that everybody is great and everybody is awesome and everybody has achieved a lot. So it's very, like, if you were like the it kid of your dental class, you're going to have a really rough time getting used to the fact that you're no longer the it kid because everybody is the it kid of their class, so it's better to just kind of get to know the people, establish good relationships with them, because if you get into residency with people, those are the people you're going to be hanging out with basically every day for the next several years. You're going to know them. You're going to spend more time with them than your family and such. But I digress. A good applicant is the one who has the score that is qualifying them for invitation for the interview. And a lot of times, especially if it's a 6-year program, it's basically that score indicates that you can pass step 1, because if you cannot pass step 1, you cannot go to med school because nobody will give you your MD. So that's basically the objective criteria. You need to get that. It always helps to have research. It's not, I don't think OMFS world is really, sort of crazy gung-ho about it. I think you should be encouraged, but it's not something that if you don't have any research, you're not going to get into a residency program. That's a false assumption. You don't have to have research, but it would help. Having extracurricular activities, and you guys are all involved and you guys are all doing things. So, and again, instead of being involved in too many things and really not into anything, just pick a few things that really sort of align with what you're trying to do and what you're trying to achieve, and talk about that, because that will come through as you've spoken about it with passion, and that will show your personality. And you have to remember, when you go through these things, this is your first time experience. This is something that you're doing for the first time in your life. People who interview people, like, we've done it multiple times. We do it every year, so it's very easy to see through personalities and see through things that you think would work with your team versus things that would not work with your team. And that's why I'm saying that it's important to show your honest, true self, because then the people who know you will fit their team will pick you as number 1. And they'll rank you high, and you just need to be able to recognize that that's your team as well and rank them. And then that's how match is supposed to work. And that's how it actually works most of the time. So besides the factual things, in terms of your letters of recommendation, be smart, because sometimes people don't say things that you think they will be saying. So definitely get letters of recommendation from people you have worked with. It helps to have letters of recommendation from your school's OMFS department faculty or program director or chairman or whoever, but somebody who's actually an OMFS who can make a comment on how you move around the OMFS world. Are you working as part of the team? And that's where the externships were important, and that's where it is important to come down and interact with your department and just to kind of for yourself, see how it works, and then also show yourself to other people. So then when you do need that letter of recommendation written, you can be like, hey, and most people will always say yes. But if you're not confident, don't ask.
Have you had any experiences like that where it's like, ooh, like this wasn't a good letter? Have you seen any like that? Because that's a scary thought. We're in the process now of applying, and it's like who to ask? How do we say, we'll write the letter and you just say it's a touchy subject, because it also takes a lot of time out of their schedule, especially if they know us on a personal level. I don't know. It is a scary thought to say somebody that you worked with. Oh man, like what can they say?
Right. So I think you should be smart about asking who you're asking to write that letter for you. It should be a person who actually knows you and who's rooting for you, right? And how you get those people. It doesn't happen overnight. You get that because, you work with them and they see you and they judge you as a person, and they're like, okay, this person is capable of doing this. This person is willing to do this, and this person is deserving of doing this. So there's, I don't know, there's no, I've had, I also went, like my application had, we had those like ranking things. I don't know if they still do that, like 1 through 5, where they rank your, like, it's on the actual like website. Was it called PASS? I don't remember these things now.
Yeah, I think PASS is in October where we rank. So we haven't gotten to that point yet, right, Deepika? I haven't seen anything. I haven't gotten to that point yet.
But so because I basically had, I think 8 people evaluate me. And a lot of them were, so I had people who I did research with, I had people who I was working in the clinic with, I had OMFS people, and I'm glad I did have 8, because one of them definitely did not say what I was led to believe is going to be said. So I'm glad, because when the interviews came about, it was 7 and 1, so you had one outlier who was basically saying not the same things that were being said by 7 other people. So then when the interviews were happening, they were like, so what's going on with this person? So then it became about that person. It wasn't about me anymore, because nobody was questioning, because you had majority of people saying completely opposite things. And then there was one person who, for whatever reason, they felt like, they needed to make certain statements and comments and whatnot.
So this was going on, I guess, during the initial application process, not like afterwards when you have to rank these. I mean, as of right now, our applications I think we have a limit of, correct me if I'm wrong,
5.
4 or 5. Okay.
5.
So we have a limit of 5. It is a lot. But I didn't have to rank anybody as far as like who I've had a personal relationship with. Like, these are all professors that I have a relationship with. So this is back when you were applying. You had to rank your evaluations as well as them rank you, or can you?
It was just my like they had like 5 different like rubrics, I guess, or something, by which they had to evaluate me.
Okay.
And it was like from 1 to 5 and whatever. And I know all that because one of the programs actually gives you your entire file during your interview, so you like get to like see all the things that like.
I actually think they still do that, but we just don't see it.
Okay.
So when they submit the letter, I think they fill it out and they do that with the letter, but we don't get to see that part, at least so far. Maybe afterwards, but yeah.
No, I don't think you're intended to see that period.
Yeah, yeah. It was kind of scary.
It showed me because they were like, "What's going on over here?" And I was like, "I don't know."
Ooh, interesting.
But,
Juicy.
To be honest, I was terrified. I thought that I wasn't sure if it's going to sink me or not. I'm like, who are they going to believe? Me, nobody, or, someone who, so it was interesting. It was a very, that was stressful.
Yeah. I mean, it is a stressful process.
That was stressful.
I know you say to relax, but I mean, it's like, we're in the moment. My brain's going a million miles a minute all day, every day. It is.
So that's when you do yoga.
Yeah, I got to get into it. I got a couple videos lying around here somewhere.
Yep. Yeah.
And then I have a couple of questions myself. Thank you for all your application tips, first of all. I mean, I know Deepika and I are going through the motions right now. 2 different specialties, but nonetheless, it's work. So thank you for that. But a couple of things that I wanted to know is, I mean, what was your most memorable case, thus far? Because you have a long career ahead of you. You're young, beautiful, successful. So, I mean, I guess thus far, what stands out to you as the most memorable case?
I think it's because it was the most recent. And so we reconstructed him all in one shot with 2 fibulas. So we borrowed his right fibula, left fibula, and what's called the anterolateral thigh flap. So we borrowed skin from the thigh. And I bent his plates. I basically created his maxilla outline, his mandible outline. I related them together. That was all pre-surgery, and then I took all that into the case, and then we actually harvested the fibula flaps and cut the fibula flaps, and it was all manual. So most of the time now when we do these types of surgeries, we use we use virtual surgical planning because it makes the case faster and more accurate and whatnot. But we didn't have the luxury of that because it was a trauma case that was acute and needed to be done. And we did 3 free flap transfers with 3 microvascular anastomoses. We harvested 3 different things, and it turned out really well. When you look at his CT scan, his projection of his maxilla and the mandible are all in the right places. Everything has healed up. We created a nose floor for him, and his chin was in the right spot. And it's just you see him recover so fast too. It was just fascinating. I mean, I'm looking forward to seeing how the rest of it will turn out, because he'll still need to have the nose recreated and everything.
Blows my mind. That's incredible. Another question would be, I guess, what's your favorite part about being an oral surgeon? I know that you mentioned earlier that you wanted to be the type of provider where you didn't have to refer out, and I think that's amazing. That's goals, really, to know everything. But do you have a favorite part?
I think the favorite part was that oral surgery gave me a portal of entry into basically being able to take care of everything in the head and neck region, because in addition to dealing with maxillomandibular things per se, I do thyroid surgery, parathyroid surgery, I do cranial base surgery, and I do all kinds of things that as a dental student in the 4th year applying to maxillofacial surgery residency, I had never even conceived of being able to do. And now it's just part of something that is so natural to me, and something that is and I think I like the the crossroads of the maxillofacial, oral, and neck, and all the other components of it, because I feel it makes me more aware of a lot of things that maybe other specialties with not such a complex training as we get account for when they plan their surgeries, or at least not to that detail that I am able to, because I spent learning about TMJ and occlusion for a year. So when I plan how to put those jaws back together and stuff like that, I think that we are trained to approach it in a way that's more specific and based on actual factual things that were drilled into us for a year in a dental school and whatnot.
Mm-hmm.
So,
and then being a woman in this career, you are, now oral surgeons make about 8% of the, dentistry right now. How do you feel about being that 8%? And do you think that the trend is moving positively towards the female side, or how do you feel about all this?
I think there's been a dramatic increase in interest on like the girls' part, first of all, and second of all, just general, I guess, acceptance, and not even acceptance, but like not making it into a big deal. It's a big deal, but I think it's generally more accepted now on like a population level, even because even if you had greatest team of attendings who were gung-ho supporters of you and whatnot, they were not responsible for every single patient who's, called me a nurse or asked me how many times have I done it, or if I've ever done it, or whatever the case is. Like, that's not something my attendings can control. So you can be, enrolled in a program that's like the most supportive and whatnot, but then if the population level is like not ready for it, they're not ready for it. And they will make you feel awkward, and they'll ask questions that you're just like, oh my God. But I think now I get a lot less of like surprised faces, like, oh, you're my surgeon. It's like, yeah, it's it becomes more normal, and it definitely has become more normal. When I was on my interview trail, there was like one other person that I crossed paths with that was a girl.
Wow.
And it was all guys. When I started my residency, it was all guys. They had one other girl who graduated before me, so they had her for 6 years and like no additional women. And then I came in. And then after me, Jacksonville was like, boom, we got 3 girls following me, 2 years. Basically, when I was a chief, we were pretty much like 48% girls and 52% guys.
That's a good deal.
In my fellow year, I think it was like, I don't know now, I would have to like actually do the math to count it, but basically we were half and half. And there were multiple times when, because sometimes people are on off service rotations and whatnot, so there were multiple times where it was just girls. It was like a whole girl team, and it was normal, and I loved it. I loved the fact that it was just normal. Like, it was just what it was, and it was cool, and nobody was kind of like, ooh, like, making a thing out of it, because it's like not a thing, So, and I had pictures from like the beginning when it was just like me rounding and like all the guys. And then I like started taking pictures when we would round, and it was like all the girls, and like one of us was like a guy. And it was just kind of cool to see that, because 7 years is really not that much time. But the transition even within my residency program was amazing. So, and then now we have like the women in OMFS on Instagram, and we had women in OMFS meetings twice already. We were supposed to have one this year, but what happened. So it's just, it's been great. And it was phenomenal to see how many awesome like women surgeons are out there and the great things that they do. And it's just like, how come I never heard of you? And how come I never like knew you existed? And it just kind of gives you this sort of sense of comfort, because when you think about it, it's like, oh, like one of like, 8% or whatever, something. And don't get me wrong, most of the meetings you'll go to, it's still like, mostly guys, which I feel like that's the case for basically anything you go to and do in a professional world. But at least now, the needle's definitely been moved. And I think that, I'm so glad to see that, more girls are interested and more girls are willing and want to, and they don't get deterred by like some, silly preconceived notions or, like these beliefs to where like, you can't have this if you do this, and you can't have that if you do that. It's like, no, maybe not in the same like way as my friends who don't do this will do their life, but I can have all these things in life. And like, we had a girl who like gave birth in her 5th year. She was my co-chief. She had a baby during her chief year, and it was totally fine. We have like, now we have a resident who's pregnant in Jacksonville. Like, it's not, it's like family building is happening, whether, people say it's going to happen or not. It's like, it shouldn't be, if this is something that you really, really like, and you really want to do this, don't let anybody tell you that, you should be scared about like not being able to do family, not being able to do kids, not being able to do any of these things. It's just like, also it's not limited to OMFS. There's general surgeons, there's so many other women. And it's just like, and I think that's the value of going to these conferences, because the 2 conferences of women in OMFS that were held in Michigan, we saw so many amazing women who've accomplished like these crazy things that you never would think would be possible. And they're like, oh yeah, and here are like my 3 or 4 kids. And it's just like, whoa, So, and I feel like if you don't see this stuff, it's easy to sort of get deterred and get like, really kind of cautious and scared when people tell you that it's impossible, because it's like, you don't see anybody who has done it. But then when you see people who have fulfilling lives with families, with all this other, like, actually life outside of surgery, which is fun. And it really sort of kind of changes how you see things and how you look at things. But overall, I think there's been giant leaps of progress that were made. And like, I welcome that. I love seeing that. And it just kind of makes me feel like I've lived a lot more life than I actually did. I'm like, it's only been 6 or 7 years, but it feels like we made a lot of progress. It's really good to see.
That's amazing. And then, is there anything else that you want to share with anybody tuning into this interview?
I guess just, do what you want to, because no one else knows what you're capable of. No one else knows what you can do and want to do. And like I said before, I think the key to success is just really being honest with yourself and really understanding where you see yourself, how you see yourself fitting into this specialty. Is this something that, will sort of, even regardless of how tired you're going to be, how stressed out you're going to be stressed out in life, period. There's always going to be things that stress you out. But at the end of the day, is it going to be worth it? I think there's just something to kind of consider, and don't let any doubts sort of deter you from something that on the inside is the path for you.
Thank you for that, Dr. Quimby.
Mm-hmm.
Thank you so much. I like literally was listening. You probably saw my head like a bobblehead the whole time. I was listening so intently. Like, that was a lot of very, very valuable information. We appreciate you taking time out of your busy schedule to spend with us and share, your journey. And I feel like we all got to know you a lot better, and a lot of the other students will gain a lot from this. So thank you.
Thank you guys so much for having me. And this, honestly, like, I'm glad you guys are doing this. I'm more than happy to talk with anyone and everyone anytime. I think it's awesome, and I wish you all best of luck in all of the things that you're pursuing. And it was, again, an honor to just kind of get to tell my story. So I'm grateful for that.
The number you have dialed is not in service at this time.
You cut out.
Deepika, we can't hear you. Maybe just the Bluetooth. Oh, we can hear you, I think.